Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In today's healthcare landscape, addressing chronic conditions like diabetes is crucial. Bariatric surgery has emerged as a transformative approach, not only aiding in weight loss, but also significantly improving insulin sensitivity. Given the strong link between obesity and diabetes related complications, this procedure offers a promising solution to reduce risks such as cardiovascular disease and poor glucose control. By exploring the impact of bariatric surgery, we can understand its role better in enhancing long term health, minimizing medication dependence, and improving overall quality of life for diabetic patients. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we have the privilege of hosting Dr. Sandeep Agarwal, a renowned expert in the field, to discuss the significance of bariatric surgery for diabetics and its impact on long term diabetes management. Dr. Sandeep Agarwal is a distinguished medical professional renowned for his expertise in bariatric and metabolic surgery. His academic journey began at the All India Institute of Medical Sciences, or AIMS, in New Delhi, where he earned his medical degree and completed his Master of Surgery. To further enhance his surgical skills, Dr. Agarwal pursued specialized training in bariatric and metabolic surgery, focusing on minimally invasive techniques. Professionally, Dr. Agarwal has made significant contributions to the field of surgery. He has been a faculty member in the Department of Surgical Disciplines at AIMS since 1999 and served as the head of Surgery Unit 2 until June 2024. In these roles, he was instrumental in mentoring upcoming surgeons and advancing surgical practices. In July 2024, Dr. Agarwal transitioned to Manipal Hospitals in New Delhi, where he currently serves as the chairman of the Institute of Minimal Access, Bariatric, GI, and Robotic Surgery. In this leadership position, he continues to pioneer advanced surgical techniques, emphasizing patient centric care and the integration of cutting edge technology in surgical procedures. Beyond his clinical achievements, Dr. Agarwal serves as the editor for the Journal of Minimal Access Surgery, a reputed PubMed Index journal that publishes original articles, case reports, and review articles in the fields of laparoscopic abdominal surgery, urology, gynecology, robotics, and pediatric surgery. Dr. Agarwal is also the founder of the Foundation for Obesity Research and Metabolic Surgery, not for profit society established to encourage and promote scientific and research work in the field of obesity and metabolic surgery. Through these initiatives, he continues to influence the field of bariatric and metabolic surgery, fostering a collaborative environment for research, education, and clinical excellence. Dr. Sandeep Agarwal's unwavering commitment to his field has solidified his reputation as a leading figure in bariatric and metabolic surgery, both nationally and internationally. Dr. Sandeep Agarwal, TIP Media welcomes you, sir.
Good afternoon.
Good
Thank you.
afternoon, sir, and thank you so much for joining us today. Sir, we all recognize that, surgical interventions can be a daunting prospect for many individuals, right, sir? And this apprehension, is often enhanced in patients who are struggling with diabetes, right, sir? So, with this in mind, I'd like to start this discussion with the most fundamental question that how does bariatric surgery work and what benefits does it offer to the patients with diabetes?
Yes, first of all, thank you for having me on your program. And, bariatric surgery is basically meant for as a weight loss surgery. So
Okay.
in patients with moderate to severe obesity, when no other, methods work, bariatric surgery provides a most effective solution for sustained and significant weight loss. So what
Right.
was seen was when the patients lose weight, the diabetes goes away. They do not
Okay.
require medication. In fact, right from the period of discharge, which is quite miraculous. And the reason is twofold. One
Okay.
is, of course, the patient is eating less because of the changes in the anatomy of the stomach and the intestine, and
Right.
they have a small pouch. But I think more importantly, there are very profound hormonal changes after surgery because of the rerouting of the food. So I'll give you an example. So in a normal person, the food empties through the stomach, let's say in 45 to 50 minutes. Okay, what is known as gastric emptying time. Okay,
Right.
so it goes down significantly after surgery, immediately after surgery. And when the food passes quickly through the stomach into the intestine, the hormone called GLP-1, glucagon-like peptide, one
Right.
which is quite getting quite popular now, it's becoming a household name actually
Right.
because of the newer medicines. So
Right.
this hormone increases immediately, and because of the
Okay.
faster emptying of food from the stomach.
Right.
So this rise in GLP-1 results in an increase in the rise of insulin after meals. Okay.
Okay.
So there's a very corresponding increase in insulin as the GLP-1 rises. And we have studied it in our project earlier when I was at Ames. So we looked at gastric emptying time, we looked at ghrelin levels, we looked at insulin levels, and we saw that there was a very good correlation between all three. That means the faster gastric emptying results in increased ghrelin, which results in increased insulin, and hence patients do not require any other medication.
Okay.
So that is one benefit, that patients either do not require medication after surgery or require very decreased doses or the number of drugs. And in fact, most patients on insulin do not require insulin at least. So that's a major thing for a patient who has to inject insulin every day.
Right.
Besides the decrease in the glucose level itself, when they're less required on medication, there's a decrease in the diabetes related complications like diabetic nephropathy. We all patients with long-standing diabetes have a kidney dysfunction, and
Okay.
a lot of them end up in chronic kidney disease requiring dialysis and renal transplant. So
Okay.
it has been seen that due to impact on diabetes itself, the chances of CKD or chronic kidney disease goes down. Okay, the chances of vascular problems resulting in cardiac, MI, stroke, or similar sort of diabetic related illnesses, retinopathy, eye problems, goes down tremendously. So it's just not
Right.
on the sugar itself, but all the diabetic related complications. So it's a really very effective way patients who have diabetes and obesity, what is known as diabetes,
Right.
they can think of about this surgery. And that's why it's now called not bariatric surgery, but bariatric and metabolic surgery. Because impacting diabetes in a very profound way.
Right.
So I've
And
answered
like say, right, sir. And like you just mentioned that it not only reduces the medication dependence, but it also, kind of controls the future complications that diabetes can actually lead to. So, just on to clarifying this particular thing further, what would you say are the eligibility criteria for diabetic patients, who are considering bariatric and now known as bariatric and metabolic surgery? And what factors determine the most suitable procedure for them?
Okay, that's a very good question. So I think let's look at the international criteria first. So the
G,
guidelines with the International Federation for surgery for obesity, if so,
G,
they recently revised their guidelines, and they came up with the cutoff of BMI cutoff of 30 with
G,
diabetes, or 35 even if they don't have diabetes. So let's talk about patients with diabetes. So if they have a
G,
body mass index, which can be calculated using weight and height,
G,
just simply get that is more than 30 kg per meter square, and they have
G,
diabetes, they are eligible for bariatric and metabolic surgery. Having said that, for Asian population, especially Indians, where we tend to get diabetes at a lesser BMI, that means we have metabolic problems at a lesser BMI, and the reason for that is we have more visceral fat. We have fat
G.
on the abdomen,
Right,
okay,
right.
which is very
G,
metabolically active compared to
G.
Westerners who have a truncal obesity. We have fat on the trunks, the buttocks, and
Okay.
the shoulders. But we see a lot of Indians have a tummy, the fat on the
G,
belly, and that
G,
is metabolically active. So for Asian Indians or Asian population, the BMI cutoffs are 27.5 kg per meter square. That is 2.5 points below the international guidelines. So
right.
if someone has a BMI of 27.5 or more, and has diabetes, and is desirous of surgery, he can be considered for surgery, of course, after a lot of counseling and all that.
Ji.
And the second question, I just can you repeat the second question there?
The second part
Part of the
was that
second part of
yes, so that what factors actually determine the most suitable procedure for that?
right. So this is always look. So first, let's look at the standard procedures. Okay, there are lots of procedures, but I'll be talking about only the standard procedures, not the experimental procedures.
Ji.
So the three standard procedures, at least in India, are laparoscopic sleeve gastrectomy.
Ji.
Okay, the Roux-en-Y gastric bypass and mini gastric bypass or one anastomosis gastric bypass. These are the three procedures. One is sleeve
Ji.
gastrectomy, and there are two bypass procedures. So
Ji.
now the debate is always between whether to do just a sleeve or a bypass. That's the debate
Ji.
among surgeons all the time.
Ji.
Okay. So then there are scoring systems that have been developed based on a lot of big data by various big centers all across the world, and they come out with scoring systems to define which procedure will be suitable. So if
Ji.
you ask me, sleeve gastrectomy is the simplest, not the simplest, but the most less complex procedure.
Ji.
Okay, and it is probably safer than other bypass procedures.
Ji.
So
Ji.
if one can offer a simpler procedure with the equivalent results, why not do that? So
Ji.
a lot of patients with less than 8 years of diabetes, okay, and who are not on insulin, okay,
Ji.
and so they can be considered for sleeve gastrectomy alone, and bypass may not be required in them. Okay. So patient with worse kind of diabetes, more than 8 years of diabetes, patient who are on insulin, patient who have a poorly controlled diabetes, a bypass procedure is preferable over sleeve. Okay.
Okay.
So
Right.
this is generally we go. Of course, there are objective scoring systems which are just guiding you. Ultimately, it's the patient's preference, I can tell you. I've
Ji.
seen patients who come having read about everything, having met
Ji.
people who have undergone bariatric surgery, and they are very clear that they want that particular procedure.
Ji.
So we normally, based on these scoring systems and our own experience, we guide them. Okay, these are the procedures which are good for you.
Ji.
This may be better, sleeve may be better, or bypass. But people sometimes know, my sister underwent that procedure, I want that only. Or
Ji.
my friend underwent that procedure, she had problems, so I want the other procedure. So
Ji.
I would say yes. In general, bypass procedures are better for diabetes, but
Ji.
there is a lot of data which has come up in over the last decade, which has shown that sleeve is also a very effective procedure. Okay.
Ji, sir. Ji. Ji. But what I understand from this is that, patients who are actually, previously programmed by their, their knowledge from, let's say, the family members or the Google University, I would say that kind of takes a lot from, from a surgeon's context to in counseling them to the right direction. Right, sir?
Right.
So I'm just simply going to understand this particular surgical procedure in 3 steps from a patient's perspective. Let's say the part where the patients, they have to prepare themselves for the surgery, then what happens during the surgery, and let's say the aftercare steps that they
Right.
should be taking. Right, sir?
Right.
So what essential steps should, diabetic patients take to prepare for undergoing bariatric surgery, bariatric and metabolic surgery?
I think first of all, they should be clear that they want a procedure. They should not be forced by their own relatives or friends to undergo a particular procedure, because I think understanding the whole thing yourselves and preparing yourself, deciding yourself that yes, I want to consider surgery as the first step.
Ji.
Okay, don't get pushed around by people that. And the second part is sometimes I've seen. I mean, that may not sound very politically correct. A lot of endocrinologists do not would put a wrong word about bariatric surgery, and
Yes.
only they would patient would they would discourage the patient. So I would
Yes.
say, I mean, at least have an opinion from the proper doctor who does bariatric surgery from a good center.
Ji.
So don't get dissuaded by myths and wrong facts about bariatric surgery.
Right.
And then I think then they should choose a good center with an experienced surgeon who is doing
Ji.
bariatric surgery regularly. That I think probably the most important part is to get counseled by a correct person.
Right.
Okay, who has been doing bariatric
Right.
surgery.
Ji.
Look at his how many cases does he do, how safe he's being, And then, of course, read about it, the procedure itself, and come a
जी,
little bit prepared. And then
जी,
during the counseling session is extremely important. Typically, spend about a half an hour to 40 minutes with a patient who is desirous of undergoing bariatric and metabolic surgery. So the
जी,
discussion is first is of course the eligibility, which check the patient is
जी,
eligible or not. We
जी,
look at their medications, and any related other problems like sleep apnea, like fatty liver, and then we counsel them about the surgical procedures itself, because a lot of them do not understand. We have got animations about these procedures, which we show to the
जी,
patients on a digital
जी,
PDF, and we
जी,
show them roughly how the procedure looks like, and we
जी,
talk about pros and cons of each procedure,
जी,
uh, the likely benefits, the weight loss trajectory. Some people think they will lose weight immediately after surgery. That does not happen. The
oh,
weight loss would always be gradual,
जी,
and it's always, typically they take about you know, over 1 year to 1.5 years, they lose typically about 40 to 45 kg, or roughly 70 to 80% of their excess weight. Okay,
wow,
right? So, and
right,
but that's gradual. Nobody comes out of the
right,
OT thinner.
right,
And we tell them about other benefits like that. Of course, the diabetes will talk about what would be the likely impact based on their profile. Like
yes,
profile would
yes,
mean their BMI, their duration of diabetes, how bad is the
right,
diabetes,
right,
insulin intake. So based on those factors, we give them an idea how what sort of a outcome are we expecting, and we can give them a
right,
fairly accurate idea of that. And will the
right,
medication totally stop, or will they
okay,
be able to decrease the medication? Whether
right,
insulin will be stopped. Okay, so these things, and of course the benefits on other organs, and then we talk about risks of each procedure separately.
जी,
Okay, these are
जी,
the likely short-term risks and
जी,
long-term risks, because that's an important discussion to have. Having
right,
said that, bariatric surgery is an extremely safe thing. I mean, a
right,
patient who undergoes the gallbladder surgery does not even know what are the possible risks, because they have to undergo it. But
yes,
bariatric surgery is probably an optional procedure. Okay, if one
जी,
does not do it, they still sort of can do without it.
right,
Um,
sir,
so they need to understand all the risks, what are they getting into, and we try to remove all the myths. There's so many myths, and my job is to give all the correct information to the
right,
patient and let them take a call based on their
जी,
discussion with us. So this is what we discuss about in the counseling session. And uh, during surgery, of course, they have to undergo a lot of battery of tests, the blood
जी,
test, endoscopy, the
जी,
cardiac evaluation, and based on their risk profile. Some of them come
जी,
very
sir,
sick, they come on a wheelchair, or they have a severe sleep apnea. So we need to
जी,
do some additional tests to
जी,
see their fitness of surgery. And
जी,
once these tests are done, their experienced anesthetist sees them, uh, okay, and sort of certifies their fitness. Of course, the dietitian comes in very early in the first counseling itself. That
जी,
what will the diet look like after surgery? Okay,
जी, जी,
because the patient has to get used to that diet. It can, so we tend to start the liquid diet a week before surgery or 2 weeks before surgery, depending on BMI. And
जी,
the dietitian goes into detail how their diet will go, what are the stages through which will they go through or the dietary transition. Okay, that's an important part of understanding before bariatric surgery. So all
right,
these factors would take into account, and then of course they will schedule the patient,
जी,
and we also counsel them a little bit about after bariatrics, what are they likely to expect. You know,
जी,
and
जी,
a lot of them think that they'll be on the bed, after surgery, which is not the case. It's a laparoscopic surgery. I can
right,
tell you, sometimes we go in the evening, we don't even know the patient has undergone surgery.
right,
It's so smooth.
oh,
The recovery is so smooth, just like a
right,
gallbladder surgery, because it is laparoscopy through small cuts. The pain is
yes,
minimal, and
mm-hmm,
especially in Manipal, we have a very experienced team where they take care of the pain very beautifully by giving
right,
drops and all. And the
right,
patient can walk almost 4 hours after surgery. We make them walk.
wow, okay,
But it's fairly smooth. And the
right,
caveat is get it done in a good center. Don't,
right,
at the cost of getting us some discount somewhere, get it done by a surgeon who is not doing it. And
right,
that's what is happening. You know,
right,
when we were students, every physician would write, I'm a physician and cardiologist. Nowadays,
जी,
every surgeon writes, I'm a laparoscopic and bariatric surgeon.
okay,
So
so,
you have to choose your an operating surgeon very carefully.
right. Right, right. And so, like you just mentioned, that just like any other particular surgery, bariatric surgery would be associated with a couple of long-term and short-term risks. So, what are the potential risks and complications which are associated with the surgery? Particularly, I'm talking for the individuals who have this pre-existing problem of diabetes.
So if you look at the complications, they can be roughly divided into immediate and late for the sake of simplicity.
Ji,
And normally, a patient with diabetes does not have any additional complications beyond a patient who does not have a diabetes. Okay.
ji, ji,
So, I mean, talking about major issue. Okay. So,
ji.
unless they have a cardiac problem due to diabetes or very severe respiratory problems, diabetes itself does not increase their risk of surgery. That's point number
Right.
one.
Okay.
Now, so point number two is the immediate risk. Let's talk. So, typically, we talk about three main risks after bariatric surgery, which occur, let's say, within a week to almost 30 days within that window of surgery.
Ji,
And the most important problem is the leak. The
ji,
leak means wherever we are dividing and suturing or connecting, like in a sleeve gastrectomy, there's a long staple line where we have cut the stomach and removed it. And these are done by very sophisticated instruments, These are
okay.
sophisticated staplers which put very strong staple lines on each side and automatically cuts. Okay, and they are motorized. They are sometimes AI based. Where they can adjust the thickness of the stomach. So they are
Ji,
sophisticated instruments, but still, sometimes because of the various characteristics, the body characteristics or the healing characteristics, sometimes a technical issue. I'm not denying that.
ji,
Leak can happen in the immediate post-op period. We do check intraoperatively for leak and we rule it out. But even then, in the first week, a leak can happen. Normally, it's a small leak, but it can become very serious if not detected in time. So that's why the importance of an experienced surgeon and a team to detect
ji,
these things early and treat
ji.
them. So leak, roughly the rate is, let's say I would put it 0.1% or 0.2%, 1 to 2 in 1,000, which is very low. For any
Okay.
surgery, these 1 to 2 per 1,000 are very low risks.
Ji,
Similarly, bleeding can happen in any surgery wherever you cut, but again, the risk is low. And third risk we talk about is the clotting in the legs. Okay.
okay.
What is known as a deep venous thrombosis and pulmonary embolism. Okay.
Ji,
So now
ji.
this DVT and pulmonary embolism can occur during any surgery or during any
Okay.
prolonged travel or prolonged hospitalization. Okay, whenever the
Ji,
patient with obesity is bedridden.
ji,
This is
ji.
because their veins are already weak, the superficial veins, and they do not pump blood effectively. Okay.
Okay.
So they have a higher risk, and there can be other reasons also. So they have a
Ji,
high risk of clotting in the legs. So what we do is during surgery and for the first 2 days, we put calf pumps on the calves, which pumps blood intermittently and keeps the
ji,
circulation properly. And after
ji.
surgery, we put them on blood thinners for about 2 weeks.
Okay.
Okay.
Right.
The blood thinner can be taken at home.
Ji,
It's a very easy thing. And so normally these are the risks which we sort of tell the patient are possible in spite of the best efforts. Nobody
ji,
can claim a 0% complication rate in the world.
ji.
So these are possible, but these are very, very acceptable, low risk compared to the risk of obesity. I can tell you the risk of obesity from head to toe. And maybe
Yes.
this is a time to talk about it, or unless you have a separate question on that. But let me talk about here itself. If
Ji.
you talk about risk of surgery versus risk of obesity, there's no comparison.
Okay.
Obesity, uh, diabetes, we're already talking about.
Ji,
70% patients have fatty liver. And it's
ji,
just not the fatty liver, it goes on to become cirrhosis in a lot of patients. Cirrhosis means
ji,
end-stage liver,
ji.
requiring liver transplant. Then 70 to 80% have sleep apnea.
Ji.
Okay. 12 to 13 types of cancers are associated with obesity.
Right.
Okay.
Ji,
The average lifespan of people with obesity is roughly 9 to 10 years lesser than a normal
right.
weight population. Okay.
Yes.
And of course, the cardiac issues, the
Ji,
infertility, polycystic ovarian disease, and last but not least, the joint problems. We do
yes.
get patients who have severe knee osteoarthritis requiring knee replacement, but then they come for at the age of 60, come for
Ji,
bariatric surgery because otherwise knee replacement is not possible.
it's
So if you look at
yes.
all these risks on one side and risk of surgery on the other side, there's no comparison. And surgery is extremely safe.
Ji,
In fact, a large database shows that it is safer than a laparoscopic cholecystectomy, provided it's done in a
okay.
good center. Yeah,
Right.
and I can send you that paper if you want. Based on
Right.
lakhs of patients, not like 500, 600 patients, lakhs of patient
Ji,
database.
जी
And
जी
then the long-term issues varies with the procedure itself.
जी
Sleep gastrectomy has very minimal long-term issues, except some patients can have increased acidity. Okay.
okay right
And the bypass procedures have a problem of sometimes a bowel can get stuck to each other and cause,
जी
pain over a long term. Again, these
जी
are manageable issues, not
हम्म
any life-threatening issues.
हम्म
And sometimes there can be minor issues like hair loss, which is a part of major weight loss. If you lose major amount of weight, 30, 40 kg by any other means, you will likely to
जी
have hair loss, which is
okay
comes back. So,
right
so these are generally the discussion revolves around whenever we talk to the patient about the risks of surgery.
okay right sir right and now again because you will be dealing with a lot of anxious patients, obesity is not a very I would say it's a very multifaceted condition which just doesn't have a toll on your health but also your mental health. Right. And the same is applicable for diabetes. So, what psychological and emotional challenges might diabetic patients encounter before and after undergoing bariatric surgery? I mean, have you noticed some changes in their attitude, their, let's say, their self-confidence, before and after undergoing surgery?
Yeah. So when we are counseling a patient, we try to assess their mental makeup and roughly based
Ji,
on our own experience, and some of these patients may require pre-operative psychological counseling,
right.
professional counseling to understand why they're eating more. Or
Ji,
specifically, we are not talking about diabetes because diabetes itself, and the issues are more due to obesity, the
ji.
psychological issues, than the diabetes. But yes, of course, both of them can be a
They're
factor in
interrelated. Right.
raising the they're interrelated. So generally, we try to make out how anxious the patient is, what are their
Ji,
concerns. I think giving
ji.
them most information in a very giving them time to ask questions probably the best way to relieve the anxiety. But yes,
Ji,
some patients who are already on antidepressants or anti-anxiety drugs, or they have eating disorders like binge eating disorder, so they
yes.
may require a pre-operative psychological counseling and also post-operative psychological support in terms of modifying their eating behavior. A lot of
Ji,
them need eating behavior modification, which sometimes needs a professional, intervention in the form of
ji.
a trained psychologist. And there are trained bariatric psychologists available in India also. And so, if these are they are required in specific situations. Not all patients require a professional sort of counseling,
Ji.
but yes, I think it's an important part to because it's been seen clearly that patients who are well prepared preoperatively, both psychologically and mentally, and all
जी,
the tests have been done, and post-operative they have a good family support, social support,
जी, जी,
and also in the times of need a psychological support, they
जी,
do better than patients who do not have these. So
right.
that's an important role for a psychological counseling preoperatively and post-operatively in some patients.
And I think a good mental setup actually helps you recover faster and have a lot of confidence in your doctor and have that communication and ask those questions. So I think
Exactly.
apart from just the mental separation, it's also I think a brain booster where you will actually have more confidence that I'll recover early. Right, sir?
Yeah,
Right.
yeah, true, true, absolutely, and then that's also what we do is we give them sometimes some patients number who have been operated earlier, who have been willing to help patients, and we say, okay, you can take these numbers, dial anyone, and talk about the
Yes.
how they have been feeling now, and that
Yes.
also gives them a lot of support,
Yes.
that such as a patient has undergone surgery and whatever issues they face, they discuss with them, and that really helps in boosting their confidence.
And I think again, the surgery would have some good positive word of mouth that I have been through a very good experience throughout
Yeah,
that phase. So that will actually, help somebody who is undergoing a surgery.
right.
So a positive impact to to the patients who have been,
Right.
advised to undergo a particular procedure, and that will help them, prepare mentally better. Right.
Right, right.
Right. Okay. Again, sir, something very important here, that can bariatric surgery completely reverse type 2 diabetes? I'm sure type 1 would be a little difficult being an autoimmune condition, but two type 2 diabetes patients, they have some hope, or is ongoing management still required?
So, the terminology is a bit you can talk about in terms of whether it's a reversal or a remission. Okay.
Right.
So when we say reversal, that means some people think it's a permanent reversal. And we say
Yes.
remission is could be for a short term or a long term. And for me, remission means for most scientific papers, when they talk about remission, they talk
Ji.
about very set objective criteria that patients are off medication for at least a 1 year. Off
Ji.
medication. That means
Ji.
okay with a good HbA1c, let's say 6.5 and below. Okay,
Ji.
for more than a year, that's called a remission. And how long that
Ji.
remission will last depends on a lot of factors. But yes, probably bariatric surgery is the only treatment which can
Ji.
lead to stoppage of cessation of medicines. In a
Wonderful.
majority of patients, I would say
Yes.
80% of patients are off medication at 5 years, and probably 60% are off at 10 years. Okay.
Ji.
And even if they are off insulin for that duration, I think it's a major thing. And after
Ji.
10 years, even if you require a little pill instead of an
Ji.
insulin high dose, it's a major,
Ji.
major benefit for the patient. So I would
Yes.
say, I mean, if you reversal remission, it's possible only with diabetes and with bariatric and metabolic surgery. No other alternative medicines, patients still require medication. I mean,
Ji.
I'm not saying they're not good. They're all good medications, and whether in allopathy, but they still require medications. Okay.
Ji.
And we're talking about a patient with serious weight and diabetes issues. We're not talking about
Ji.
a patient who is normal weight. Okay. So the caveat is, so we're talking about a patient with obesity and diabetes, where
Ji.
they require medication for diabetes control.
Ji.
Of course, some patients who have strong willpower can do it lifestyle modification. I'm not denying that
Ji.
lifestyle modification, but there's a yo-yo effect with lifestyle modification. Okay.
Yes.
So when you lose amount of, let's say you lose 5 kg, you gain 8 kg. So this
Ji.
we have seen a lot of patients. Some patients do not agree for surgery. They come and they say, okay, we do not want, and they come back 1 year later or so, becoming fatter, becoming worse with worse diabetes.
Yes.
So, I would say yes, reversal is possible with bariatric metabolic surgery with in a
Yes.
sort of this thing, whether you call it reversal, remission. I would not use a term cure, but remission, yes, definitely.
Yes. And I think lifestyle modifications is something that would help in sustaining the benefits of bariatric surgery.
Oh,
Right, sir?
absolutely, absolutely, for sure. For sure, they need to change their lifestyle. One
Ji.
can't, just depend on bariatric surgery and eat
And
whatever.
continue. Yes.
Yeah, they
Yes.
have
So I
to
think a
be
good
a
diet,
part of that.
moderate exercises, and a
Exactly.
good, and a good psychological,
Yeah,
let's
yeah.
say, positivity, and everything will work. In
And also, all these needs require a continued support. And we, at our program earlier at Dave, when you were at Manipal, we have a
Ji.
very regular patient support group meetings. And we do
Wonderful.
not do these meetings to get new patients. We get these to support the already operated patients.
Yes.
Because if there are some minor issues that can be discussed, sometimes they are reluctant to come for follow-up. They will come for follow-up.
Ji.
We give them lectures and the talks on, continued management of physical. We call a good physical trainer. We call a motivational
Ji.
speaker. So
Ji.
we do all these to support them through the journey of weight loss.
Yes. Yes. And I think that's a wonderful initiative, I must say.
Yeah.
And now coming on to thoda sa aapka personal experience, because you've been discussing with us that you've, in this, in your experience, you've actually met a lot of patients who've been, who've been feeded in with a lot of myths and misinformations. So just now onto correcting such patients, what impact does a patient's health literacy, have on their ability to adhere to post-surgical care in particular, and achieve long-term success, let's say in bariatric and metabolic surgery?
That's a very interesting question. And I really don't think we have any solid data to say that patients who have more health literacy will do better. I don't think there's any study which has looked at that. We did conduct a study at AIMS on knowledge, attitude, and practices, what is known as KAP study, on
Yes,
patients
sir.
who were coming for bariatric surgery, and looked at that. But of course, that
Okay.
was just a preoperative evaluation. But
Ji.
to say that patient with better health literacy would translate into better outcome, I'm not too sure about that.
Okay.
Of course, I think personally feel they should be the expectation should be made very clear in the preoperative period that they
More
need to do everything.
realistic.
Yeah, the realistic one, they do not lose all the weight. They lose 70 to 80% of excess weight. And nobody wants to lose actually all the weight. And that I've seen with the patients. Second is that they do have to be very regular with the physical activity, whether it's cardio and later on muscle strengthening, because as a part of weight loss, you do not want patient to lose muscle.
Ji.
So we do, counsel them about all that. And so I think it's also, the whole thing probably depends on the continued regular follow-up and support.
Ji.
So because all of us get very motivated on 1st January, okay, we'll go to the gym, but they're
Okay.
fitter surgery. The same thing with
Yes.
bariatric surgery. Initially, when they lose weight, they're like pumped up and all, and then they
Ji.
do everything, but then it's sort of fitter surgery. So what we need to do is
Ji.
call them regularly after 1 year, 2 year,
Ji.
see what they're doing, and that's what we've been doing in our, our program. That we personally, we ourselves call up the patient, ask them how they're doing, and
Ji.
we hold these meetings, which are very crucial. So that's what.
Okay, so I'm going to add something to it, though you don't have a data, but I think this conversation would be a great health literacy initiative in reaching out to the people who should listen to the right person and they should know where to contact for what, right?
Yeah.
Okay, so I'm just going to summarize this wonderful session, sir, by asking that could you provide a detailed to-do list for your patients who have been advised to undergo bariatric and metabolic surgery?
Okay. So first of all, ask yourself, you do you want, are you, troubled? Do you have enough problems with your obesity and, diabetes?
Right.
Are you really troubled by that? And is it not getting controlled properly?
Ji.
What is your BMI? Because if your obesity is also there, significant obesity, then probably you have a stronger reason. So first, yourself have a little conviction in what we're going to do. Because
Ji.
unless and read about it a little bit from the right sources.
Yes.
Then second is choose the right program. By the right program means choose the right hospital and the team and a
Ji.
surgeon who's regularly doing these surgeries. Of
Ji.
course, you can look at the net, of course, and also, from other patients, possibly if you're in touch with them.
Ji.
But I think choosing the right thing, right center program, probably to me is absolutely should be ticked in your to-do list that yes, I have done my homework and I'm going to the right
Ji.
person. Okay, or maybe take another 2 opinions. I mean, may
Ji.
not be in the right place in the first time. Okay,
Ji.
don't listen to unsubstantiated myths about
Ji.
surgery being
Ji.
unsafe. Actually, please don't think surgery is unsafe. Have a very positive outlook for it. That yes, it's a thing which is going to change my life, and it's
Ji.
a very safe thing.
Ji.
And so from there, when you go for the counseling, have a detailed counseling. Ask a surgeon how many cases does he do every month,
Ji.
or how many cases he done in his career.
Ji.
Okay, and what are his generally success rates? Or what possible bad complication he has seen in his own experience.
Ji.
Okay,
Bilkul.
and we're on discussion. Okay, and don't hesitate to ask questions about these things.
Ji.
Okay, these are important. You're giving your body to be operated by someone, so you need to show that he's the right person. He or she is the right person. So and then go through all the tests. I've seen patients, coming, then they would not follow your instructions completely. They say, okay, is this test necessary? Okay, yes, it's necessary. Then they come with half the reports next time. So
Ji.
do all the things which have been advised to you for your own good. Okay?
Ji.
And then lose a bit of, and don't hide any information. If you have a history
Ji.
of alcohol intake or a smoking
Ji.
history, be very upfront with it. Because we do not do bypass procedures in patients with smoking history. So if you hide that history, you may land them into problems in the wrong procedure.
Yes.
And of course, I think come with a person whom you trust. Don't come alone for counseling. It's very important for someone who will support you through your
Yes.
journey, not make
Yes.
fun of you, not accuse you of taking shortcuts.
Yes.
Get someone whom you trust in the first counseling itself and maybe in the future. So I think these are the things which are important when you are considering bariatric surgery.
Right, sir. So self-motivation, background check of your surgeon, open communication, and then adherence to your surgeon's instructions.
Absolutely.
And most importantly, not to follow any myths. In particular,
Yeah.
that surgery is not, a shortcut. Rather, it is a treatment modality to help you, to support you live a better life. Wonderfully put, sir. So
Yeah,
thank you so much.
it's very sad. It's very sad that it's stigmatized. I'm just
Yes.
sorry. It's stigmatized by a lot of physicians also. It's so much of scientific data published in very reputed journals like New England Journal of Medicine, JAMA, Lancet. And even then, there are false beliefs which spread about surgery. So I think one should take it in a positive way, think it as a life-saving thing, and of course,
Yes.
it's the whole team. You have to be a part of the whole journey.
Ji. Bilkul. And how wonderfully you've put all of this together. So I really appreciate your presence with us today, sir. And I'm hoping that the enlightening information shared will be valuable to many families who are struggling with, the metabolic conditions such as diabetes. So thank you so much for joining us. It's really been a pleasure.
Thank you, Dr. Soumya, for the opportunity. Thank you. Thank you.
Thank you so much, sir.
Yeah.
And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.